Good morning. This is Dr. Sanders with Western Medicine Exposed. This morning, it is Memorial Day. So today we are honoring all the soldiers, the men and women that never made it home, and we thank them and their families for preserving the freedoms that we have in this country. For today's discussion, I thought we could talk about prior authorizations, known as PAs. PAs are something that we deal with every day here in the clinic, and most places do, clinics, hospitals, wherever. And it's basically what it is. It's if you order a test, a provider orders a test on a patient, or a treatment, or medication, or whatever it may be, and the insurance doesn't think that it needs to be done, you have to get a PA, and the insurance will then send you a PA number that you can send in to wherever, showing that the insurance company has approved it so the test can be done. So for instance, let's say you come into your provider and you have low back pain, and you had it for years, and you had multiple different medications. You've had pain medicines, and you've had maybe you've used some lidoderm patches, and maybe you've used ibuprofen, and maybe you've had home exercises, who knows, and it's just not getting any better. So your provider orders a MRI of your low back. Well, almost invariably that is not going to be approved by the insurance company. They're going to come back and say that you have to have at least 6 weeks of physical therapy first. Then they may or may not approve it. Let's say you come in with acute low back pain from a car wreck that you had 2 days ago, and your provider orders an MRI. It's not going to be approved unless there are some major red flag symptoms that they would approve it for. Let's say that your provider orders a medication and the insurance company doesn't think you need it. They will deny covering that medication, and then either the patient has to pay cash for it, or they have to get some type of alternative medicine, or your provider will have to go through a lot of paperwork to get a prior authorization. So for instance, on the medication, let's say that your provider orders a medication and it gets to the pharmacy and the insurance doesn't cover it. They will then send back something called on a website called Cover My Meds, and then your provider will have to fill out all the information on why you need that medication to try to get it approved. So what does all this cause? Well, one, it causes a major delay in care. Sometimes these take days, sometimes it takes weeks to get a prior authorization through. So the patient is going to be stuck waiting for this therapy, procedure, treatment, whatever it may be, maybe weeks, while the insurance company decides if you need it or not. Not only does it delay in care, many times it's practicing medicine without a license, because these insurance companies, without any medical knowledge, or somebody that has a medical license, is deciding what care you should and shouldn't receive. Often though, it will be put into what's called a peer-to-peer status, where your provider will have to call the physician at an insurance company and then discuss with them why you need a particular therapy or treatment, and then that physician will then make the ultimate decision on whether it's approved or not. Now, sometimes that will go through, but what's the problem with that? It takes up a ton of time. So now you're into your provider, instead of actually seeing patients and trying to take care of people, we're spending all our time on the phone with insurance companies trying to get various things approved for other patients. Not only is it taking up our time, it's taking up our staff's time, because they have to spend hours either on the computer, filling out paperwork, logging, checking, tracking, all this stuff for these prior authorizations that sometimes fall through the cracks with the insurance companies. They never get back to you. Sometimes on the computer, it doesn't automatically show up that it's been approved, so then you have to go and look for it. And so it takes up a ton of time from an administrative side. Often the procedure or the therapy, the medication, whatever, is denied. And so now patients aren't receiving care that they need, and they're having to use less effective medications. They're having to get alternative imaging or alternative therapies, alternative procedures that may not be as good as what the initial thing that was ordered is. And then lastly, many insurance companies have different criteria for what's approved. So one patient may have Humana, one patient may have Blue Cross, and both patients come to see the same provider, the same test is ordered for the exact same problem. Humana may be approved, Blue Cross may be denied, and there's no rhyme or reason as to why that happens. It's just the way it is. And so here the patient is, again, one of them is getting what they need, one of them is not, and having to have their care delayed, maybe even denied. And we have insurance companies doing an illegal thing of practicing medicine without a license, and how they get away with that, I don't know. But best I can tell, taxes and insurance companies are really the only legalized form of theft that I can see, because not only are they not approving care for patients, they are paying providers a ridiculously low amount, what's called an adjusted amount. For instance, say you bill $100 for sewing somebody up, they may say, well, it's not really worth $100. You only get $20. Now, I can't go into a grocery store and get a gallon of milk that's $4 and get to the register and say, it's really not worth $4. It's only worth $1. That's what I'm giving you, and they have to take it. For us, we either take the $20 or we get nothing. So it's basically legalized theft. Lastly, what I'd like to mention about these denials and these prior authorizations are that last summer, multiple of these large insurance companies, their CEOs were bonused based on how much denials they were giving or how many denials they gave. So all these companies, their CEOs were making money for denying care to the members that they're supposed to be taking care of. That was on the news. And I know, the news is not always honest, and something like that, if they're reporting it, it was more than likely true. But we do know that these denials go on all the time, and I'm sure these CEOs were bonus because they were, quote, saving their insurance companies money, but they were, in turn, providing terrible care to the members that have their insurance. So anyway, that's part of what we want to do with Western Medicine Exposed, is let everybody know kind of what goes on behind the scenes, what goes on with insurance companies and pharmaceutical companies and all this other stuff that people probably have no idea about. We just want you to know what goes on with Western medicine in America. It really is not good currently. I mean, healthcare is terrible. So we just want to get information out there so everybody kind of knows what's happening. And if your care is delayed, that it may not be your doctor that is causing the delay. It very well may be an insurance company. So anyway, y'all have a good day, and I will see y'all next time on Western Medicine Exposed.